Welcome to the deep dive. Today we're tackling something I think most of us know probably too well, overcrowding and, well, just time slipping away in healthcare settings.
Definitely. We've gone through quite a bit of material articles, a really interesting podcast episode from Lifelines by Supreme Medic, and info from groups focused on, healthcare quality.
Yeah, and look, if you've ever felt that frustration, stuck waiting forever, or feeling like your actual appointment was just rushed through.
Or just the general chaos of a busy clinic waiting room.
Exactly. Then this deep dive is really for you.
Our goal today, really, is to pull out some actionable things, some strategies you can actually use to navigate the system a bit better.
Think of it as a shortcut, maybe, to being better informed and hopefully making those visits less stressful.
Let's dive in. So first, maybe we should just understand the problem itself a bit more. Overcrowding isn't just, inconvenient.
No, it has real effects. It makes me think of experiences like being in packed waiting rooms in India. It's almost a default image for many people there.
It is a very common scene. And you immediately wonder, okay, why is it like this?
What's driving it?
Well, that Lifelines podcast had some key points. First, just the sheer volume of patients in a place like India. Huge population, high demand, especially for affordable care, government hospitals.
Right. The numbers themselves are massive.
Absolutely massive. And that puts incredible pressure on the system.
It's not just seasonal flu or something. It's constant high demand meeting. Well, what?
Meeting limited staff and resources. That was the second big point from Lifelines. Shortages of doctors, nurses, sometimes even basic equipment.
Mm-hmm.
And you see this even in small clinics with just one doctor trying to manage everything. It directly leads to those long waits.
So it's a bit of a bottleneck situation, high demand, constrained resources.
Precisely. A chain reaction, like you said. Longer waits are almost inevitable in that scenario.
What else did the podcast highlight as a cause?
Another really big one they mentioned was the prevalence of walk-in appointments, or rather, the lack of mandatory scheduled appointments in many places.
Ah, okay, so people just show up whenever.
Yeah, which means you get these totally unpredictable surges. Like everyone decides to come first thing Monday morning, boom, instant overcrowding.
Right, you can picture it, like rush hour hitting the clinic. But didn't Lifelines also suggest it's not just about needing more doctors or beds, something about planning?
Yes, exactly. They had this really key quote, something like, "The problem isn't always too many patients. Sometimes it's poor planning and miscommunication."
Okay, that's interesting. It suggests there are ways to improve things even with the current resources.
That's the crucial takeaway. It opens the door to solutions beyond just building more hospitals. It's about working smarter.
Right. So let's pivot to that then. Let's really dig into those solutions. What are the practical steps, the things you listening right now can actually do to navigate this better?
Okay, yeah, let's focus on the proactive stuff. One of the most effective strategies mentioned in pretty much all the sources is booking appointments in advance.
Seems basic, but maybe underutilized.
It can be. But thinking ahead and scheduling isn't just good for your time. It helps the clinic or hospital spread out the demand. Makes the whole system work a bit better.
Okay, so how can people do that easily? What are the tools?
Well, loads of places have online booking now. There are apps, like Practo in some regions, or just checking the hospital's own website.
Right.
You can often see the open slots, pick one that works, and potentially skip those really busy periods.
So a bit of digital legwork pays off. What if booking just isn't an option, though? Or it's an urgent-ish situation?
Good question. In that case, Lifelines suggested trying to aim for off-peak hours. If you have some flexibility, that is.
When are those typically?
They noted that early mornings, right when they open, and late afternoons tend to be the craziest, especially on weekdays.
Okay.
So if possible, maybe aim for mid-morning or mid-afternoon. Even earlier in the week might be slightly less busy than, say, a Friday.
It's like timing your commute, but for healthcare. What else can technology offer here?
Teleconsultation. This came up a lot. For follow-ups or things that don't strictly need a hands-on physical exam.
Yeah, that's blown up recently.
It really has. And it's a huge time saver. No travel, no waiting room. You avoid the whole crowded facility experience.
Makes sense, especially for routine check-ins or prescription refills. But okay, say you do need to go in person and appointments aren't standard practice there. Then what?
Then Lifelines had a really simple tip. Just call ahead, ask about the current wait time.
Really? Do places actually give that info?
Many hospitals especially will give you an estimate. It's not perfect, but it can help you decide, should I go now or wait an hour? Avoid some wasted waiting room time.
Huh. That's actually a great practical tip. A quick call could make a difference. What about the rules the clinics themselves set up?
Right, paying attention to those is important too. Lifelines pointed out that facilities often have policies to manage flow, maybe timed entry, or appointments needed for specific
Or
tests.
limits on walk-ins per day.
Exactly. Knowing and following those rules helps everyone, makes the process smoother overall.
Okay, so we've covered ways to potentially avoid the worst of the crowds. But what about when you're actually in that busy clinic? How do you make the visit itself more efficient?
Yeah, because sometimes crowds are just unavoidable, but you can still optimize your part of it. Lifeline suggested arriving a little early.
How early are we talking? Not like an hour before, adding to the problem.
No, no, just maybe 10, 15 minutes before your scheduled time.
Yeah.
Enough buffer to check in, fill out forms without feeling frantic.
Right, avoids that last-minute stress.
And it helps if there are any small admin issues. You're not starting off delayed because of that.
Being prepared seems crucial, too, for the actual consultation.
Oh, absolutely. Lifeline's really hammered this home. Prepare beforehand. Jot down your questions, your main concerns, gather any relevant past records, list your current medications. Bringing that stuff with you saves so much time during the actual talk with the doctor.
Yeah, stops you leaving and then remembering the key thing you forgot to ask.
Exactly, which is so frustrating. What about when delays just happen, though, even with an appointment?
Right, because they do. Emergencies come up.
Yeah. So Lifeline's advised just trying to be flexible, be patient. It's tough, but getting worked up doesn't help. Maybe bring a book or have something on your phone to do while you wait.
Manage your own expectations a bit.
Kind of. And then when you do get in to see the doctor, how do you maximize that time?
Good question. It can feel rushed.
Lifeline's suggested being really concise and focused. Start with your most important issue.
Get straight to the point.
Pretty much. Respect their time, but also, if you feel you genuinely need more time, it's okay to ask. You could say, is there time to discuss one more thing, or should I maybe schedule a follow-up?
So it's about being efficient, but also advocating for your needs if necessary.
Right, it's a balance. Now, maybe we can zoom out a bit. We've talked a lot about individual actions, but what about the bigger picture? The system-level stuff?
Yeah, what are hospitals and systems trying to do to fix this on their end?
Well, that Optimizing Healthcare Visits article gave some good insights here. A big focus is just streamlining the basic processes,
Like what?
like triage sorting patients effectively, making registration smoother, discharge faster, reducing those admin bottlenecks, frees up staff, and keeps patients moving.
Okay, cutting down the paperwork and waiting around time. What about tech?
Tech is huge. Electronic health records, EHRs, are key. They help with scheduling, tracking where patients are, sharing info between departments. It makes everything potentially much smoother.
So better data flow equals better patient flow.
Pretty much. And telehealth, as we said, helps manage demand remotely. Some places are even using digital tools for patients to input symptoms before they're seen, speeding up the initial assessment.
Interesting. What about finding the actual log jams in the system?
That's where things like specific models come in ways for administrators to analyze where the system breaks down. Is it staffing? Not enough space? Are certain processes just inefficient?
So they try to pinpoint the weak link.
Exactly. And then address it. Like optimizing staffing schedules to actually match when patient demand is highest, or improving how different departments like the lab and radiology talk to each other.
It sounds like a really complex puzzle they're trying to solve. The article also mentioned discharge. How does that fit in?
Yeah, getting patients discharged efficiently, especially earlier in the day when it's safe to do so, frees up beds faster. That helps reduce backups in places like the emergency department.
Ah, okay. Prevents that no beds available situation.
It helps, yeah. Same with managing elective surgery schedules smoothly so you don't get sudden, overwhelming surges.
And what did Lifeline suggest specifically for hospitals and clinics to implement?
They had several practical ideas, like just having really clear visiting hours and appointment policies readily available.
Simple but effective.
Using tech like token systems or SMS queue updates or apps to manage flow and keep people informed. Maybe setting up separate zones for different kinds of care walk-ins here, routine checks there.
Streamlining the physical space.
And again, really leaning into offering teleconsultation options.
It really feels like a mix of individual responsibility and these bigger system changes needed. Lifeline's had that nice summary too, right? The educational note for patients?
Yes, they did. It was a good way to frame it, like habit. Just showing up whenever. Better alternative. Try to book, or at least call ahead.
Okay.
Habit. Bringing the whole family to an appointment. Better alternative. Usually just one helper is needed, unless there's a real reason.
Cuts down on crowding.
Yeah. Habit. Waiting passively for hours. Better alternative. Ask about the queue status. Use an app if they have one.
Be proactive.
And the last one. Habit. Rushing to the hospital for a minor cold. Better alternative. Consider a local clinic or even a pharmacy doctor first. Use a right level of care.
Those are great, really concrete shifts in how we approach things as patients. It all comes back to feeling a bit more empowered, less stressed, right?
Exactly. Understanding these wider issues, both the problems and the potential fixes, helps you make smarter choices for your own healthcare.
Okay, so let's try and wrap this up. We've covered a lot today in this deep dive on healthcare crowding and time management.
We look at why it happens for the art, the high demand, the resource limits, the impact of walk-ins.
But more importantly, we pulled out strategies for you, the listener. Things like booking ahead whenever you can.
Choosing those off-peak hours if possible. Using teleconsultation when it makes sense.
Calling ahead for wait times, knowing the facility's rules.
And then, during the visit, arriving a bit early and prepared, being patient with delays, and being focused during your actual time with the doctor.
And we touched on the system side, too. The efforts to streamline processes, use technology better, like EHRs and telehealth, tackle bottlenecks in staffing or flow.
And improve communication and coordination within healthcare facilities. It's a big effort on all fronts.
Which leads us to maybe a final thought for you to take away. Beyond all these specific tips and system changes, how can your own awareness, your own choices, actually help make the whole system work a little better, feel less stressful for everyone?
Yeah, it's a good question to ponder. What's one small tweak you could make in how you approach healthcare visits that might ripple outwards? Or maybe thinking bigger. What do you see as the single biggest bottleneck in healthcare efficiency, and what kind of innovative solution could tackle it?
Definitely something to think about.